Hello and welcome
Okay.
to One Health Wednesdays. We have conversations and clarity at the intersections of people, animals, and the planet. I'm Dr. Ginger Dixon. I'm a public health strategist, systems consultant, and believer in infrastructure that supports the mission. On Wednesdays, we dig beneath the surface of One Health work to explore what's really shaping your impact, whether that's the workflows, the relationships, and the rhythms that hold cross sector efforts together. So let's get into it with our special guest. You may know him from our previous episodes. We have Dr. Chanchal Bhattacharya, who is a veterinarian, One Health specialist, coming to us from India, and he is now a senior advisor with Hafer International, and I'm incredibly excited to welcome him today. Welcome, Dr. Bhattacharya.
Thank you. Thank you very much, my old friend. Thank you.
Yeah, thank you so much. I know we become old friends now at this point.
Yes, yes, yes. Right now, we can consider each others that we are old friends, we are old colleagues. So we are
Yes.
working together for a long time. So I'm very happy to be here. You see, Ginger.
Thank you so much. Very happy to have you back, old friend. Um, yeah, and so I today we thought that we would um, dive into a little bit of a I guess a more structured uh, episode here, just to kind of get some updates from Dr. Bhattacharya on the status of One Health in India, and then we kind of want to talk through some of the challenges that have come up, and his insight on those. So, um, Dr. Bhattacharya, if you wouldn't mind to share just broadly, what does One Health mean in your work?
Okay. Uh, actually, what exactly One Health already we know. One Health is a collaborative, multi-sectoral, and transdisciplinary approach which deals from local to global. Okay, local, regional, national, and global levels. We are working in respect of One Health. Basically, One Health is meant for the overall health of human being and planet as well, and the intersection between people, animal, plants, and environment. Uh, all the things are dealt under one umbrella. So, in my perception, this is One Health, and all of us, different experts are working in this One Health subject. Not only veterinarians. I'm a veterinarian. I'm for a long time. Definitely, I'm associated with that. So, my perception is like this. This is One Health. Actually, in respect of our country, you see, India. In respect of our country, uh, we have a very complex situation in our country because the population is we are having a very large population. Right now we have crossed China, and we are the number one in the world in human population, and simultaneously we have a very big livestock population, and the coexistence between human being and livestock make a very complex situation in this country. So simultaneously, uh, the urbanization, the thickness of population, then hygiene and sanitation issues. There are a lot of things which are creating mm, a, a risk of zoonotic spillover in our country. Okay, because of that, we are very much concerned, and for that, uh, I think that One Health approach is the only approach through which we can combat with this problem.
I think that's a great perspective, and absolutely. I mean, thank you for already kind of highlighting, some of those challenges and how there's this very special situation in India, having the large populations of human and animals that, live and work closely together. So, thank you for sharing that. And I'm curious to know what part of, the One Health system do you see that you feel that others are missing that can maybe be incorporated more into this work and to solve these challenges?
You see, actually, if we are considering One Health as a whole, so in our country, our major aims are to reduce the risk factors of zoonotic pathogens. as a whole. So for that, you see, already I have mentioned you that One Health is a multidisciplinary approach, and all the things are correlated. So here you see, there are five factors, five most important factors through which we are trying to work in our country. As an example, reducing threat at the human, animal, and environment interface. What I have already mentioned. Then tackling antimicrobial resistance, AMR. AMR is a very, very big threat in front of human civilization right now, and everybody is concerned about AMR, not only in animal health sector, but also in environmental health and human health sector. Everybody is concerned about AMR. So we are taking stringent steps to reduce the antimicrobial use of antibiotics in uh, uh, animal health sector. Then ensuring a complete food safety. You see, when you are, as an example, since I'm a veterinarian, I'm talking much more about the livestock sector. When we are talking about a good food safety approach, then you must consider certain things. You must impose very good biosecurity practice. You must impose very good animal husbandry practice, then reduction of antibiotics, then proper vaccination, then risk communication, then traceability of the animals. These type of things should be undertaken for a good food safety approach in our country. What we are already working. Then you see we have a very big biodiversity uh, and jungles and uh, you see our country is a big country. So there are a lot of forest lands and hills. Then there are oceans, rivers. So a very big biodiversity you can observe in our country. So we are very much um, protective about our biodiversity, because we know if we can protect our biodiversity, we can protect the human health, animal health, and environmental health. We are much concerned about some environmental issues in which, actually air pollution, water pollution, then noise pollution. There are so many things which are not only linked with One Health approach, but also it is directly impacting on human health issues. Okay, as an example, if you are living in an urban area, the noise pollution is too much, then it directly creates a lot of problem on you. It can reduce your ears condition. Then it can create a lot of tension on your psychological aspect. Then you see, overall, it is a health hazard. Then simultaneously, if there is a air pollution, you may have respiratory problems. So we are very cautious about it, and we are trying to chalk out a composite program through One Health approach, so that we can reduce all these things in our country. Okay, these are the five major factors through which we are trying to work on that. You see.
Yeah, absolutely. And you definitely highlighted important factors, important focus. And I think it's great that you brought up the pollution aspects too, and how
Yeah.
it's impact environmental health and animal health and human health. And absolutely, those are great points. Um,
Another one point, Ginger, I would like to mention it, that is the climate change. Climate change is
right.
creating havoc in our country, not only in our country, but also globally. You see, in
Mhm.
case of climate change, if you are observing the disease dynamics, especially the vector-borne disease, it is absolutely different. What it was 10 years before, right now, the things are not like this. If you are analyzing the Japanese encephalitis or dengue fever, okay, or malaria fever, you will find out that disease dynamics is changing, disease ecology is changing, and you see the vectors, the characteristics of the vectors, like mosquitoes, like other vectors, it is changing rapidly due to this global warming. That is also a major concern for us.
Yeah, that was actually part of my research in my master's program was looking at different ways to kind of estimate, mosquito season because we know that the climate is going to affect the way that they spread and how early that season starts and I know in the United States here, West Nile virus is also a huge concern, and it's actually affected the range of, the mosquitoes and the spread of West Nile virus, and really accelerating that. And so, absolutely, that's a huge
Yeah.
impact to take into account too. Yeah, and on that note, where, and I think you've highlighted some of this already, but where do things kind of break down when these sectors, whether that's the animal, human, environmental sectors or other stakeholders, when they don't align or they're not applying One Health, where do you see that affecting things?
Yes, yes, absolutely. Here, I would like to highlight a few things. You see, as an example, natural disaster. When the natural disaster occurs, you have to have a contingency plan from One Health point of view, because when the natural disaster occurs in a particular place, maybe it is a flood, maybe it is a cyclone, or something storm,
Mm-hmm.
then the total population is suffering. The total population, not only human population but also animal population, they are suffering. Even the environment is suffering. So you must have a proper contingency plan to combat with the situations from One Health approach. You see, as an example, in our country is a flood-prone country. Very recently, we have devastating flood in northern part of our country, and we had tough time to combat with it. But thankfully, we have a solid disaster control uh, SOP and plan. Okay, so we executed this disaster control SOP, and accordingly, we have saved a lot of lives, a lot of human lives, a lot of animal lives. We compensated with medicines, then vaccines, then animal feed, as because earlier we anticipated that this type of things could happen in our country. So
Mm-hmm.
a contingency plan should be in place, and you must do the data analysis according to the meteorological data, that at what time the rain will be there, what time storm will be there, or cyclone will be there, or tornado will be there. So if you are analyzing this data, you will be able to take some necessary action about it. So this is very important also from One Health point of view.
Absolutely. You're speaking my language, Dr. Bhattacharya. You're speaking data and SOPs and contingency plans and preparedness. Yes, that is exactly what we're working on as well. So thank you. Those are great points. I agree 1,000%. Yeah, and so thankful that that y'all did that work, y'all coordinated, y'all planned and prepared, and as you said, really the goal is to save lives, and to reduce impact of things that we can't necessarily plan exactly when we'll be here, but we know that there's a high risk, and so it's worth taking the time to plan for. Absolutely. Thank you for that. So what else is there a maybe this is to do with planning or maybe in another area, but is there kind of like that process that no one talks about that tends to affect your outcomes in your work?
There are certain things which is neglected in our country. You see, although we are shouting a lot about the intersectoral coordination and capacity building,
Mm-hmm.
uh, you see, actually the major stakeholders of One Health in our country is our Ministry of Health and Family Welfare, then Animal Husbandry Ministry, Animal Husbandry, Dairying and Fisheries Ministry, and Ministry of Environment, Forest and Climate Change. Okay, there are other stakeholders: Department of Biotechnology, Department of Science and Technology, Indian Council of Agricultural Research, Indian Council of Medical Research. But the major stakeholders who are working in the ground, they are Ministry of Health, Ministry of Animal Husbandry, and Ministry of Environment. Okay, definitely there are some international organizations like FAO or WHO. They are parting with them, and they are, as an example, if we are considering pandemic fund is basically implemented by Ministry of Animal Husbandry along with FAO in our country. Okay, just like this. So you see, sometimes initially when I started talking, I told you that One Health starts from local to global. Okay. So when we are considering the local situation, sometimes as an example, block or subdivision, people are not well equipped about the One Health strategies. You see, they have yet to develop proper SOP or proper preparedness. And sometimes there are lack of funding, there are lack of capacity building programs. So these things are there, and already we are giving much stress about it. As an example, I'm just giving you a live example. We have integrated disease control program, IDSP, integrated disease surveillance program. It is under Ministry of Health and Family Welfare. Okay. So what they did, they have established a IDSP unit in every district of India, and uh, they have taken a veterinary expert in their team. Okay. So why the veterinary experts had been included in their team? Because there are certain outbreaks of diseases of zoonotic origin. Okay. So in case of any outbreak of zoonotic origin, the veterinary expert will intervene, and the integrated disease surveillance project team will use the expertise of veterinarian. That is also a significant development in our country also. And we are getting more and more authentic data regarding zoonotic diseases. You see, uh, sometimes you see our country is a very vast country. What I felt that in grassroots level, as an example, in grassroots level, in villages, sometimes we are facing problem to control disease outbreak, or sometimes we are facing difficulties to provide the cool chain of vaccines. As an example, I am working with the community, okay, large scale community in different states of India. There are tribal people. You see, there are places where in villages facilities are not available. Maybe for them, they have to travel 25 kilometers to procure the vaccines. As an example, Newcastle disease vaccines for poultry, or PPR vaccine for goat. So they have to travel 25 kilometers, 30 kilometers to procure the vaccine. But after that, sometimes they are facing to get it properly, get a proper storage facility. Okay, maybe um, the refrigerator is not properly working. Sometimes there is no electricity like this. There are a lot of villages in our country where these type of problems are there. So what we are doing right now, this is a very sustainable approach from our government and from different organizations. We have introduced solar energy system, solar panel. Okay, through
That's
solar panel, we have generated electricity and we store it in battery. If we do not have any electricity supply, then we are switching it to our solar originated electricity. Okay, so that there will be no interruption between electric supply and our, as an example, the cool chain for vaccine. It is absolutely necessary. The vaccine should be stored in 2 to 8 degrees centigrade. So you have to run your refrigerator for that. So if the solar energy is active, then we can take the help of solar energy and we can run our refrigerator or cool chain facility. You see, these things are very enterprising. Definitely, there are problems, there are challenges, but uh, uh, our experts are very smart. Always they are trying to identify some solution which may be improvised or which may be locally available. You see, that is a very good thing in our country, because you see, our country is a big country and the situation is different in north, in south, in east or west. So appreciating the local situation, our smart experts are developing local technology. Okay, so they are combating these things, and it is very enterprising. I'm very impressed with it. This.
Yeah, me as well. I think that's definitely encouraging. And, and that's a great point too. It does look very different, for different regions. And um, as you said, I'm thankful for the smart people that are coming up with, these very innovative solutions. I think using solar energy for vaccine cold chain storage, that's fantastic because that's been a long-standing problem in many regions, is
Yeah, yeah.
keeping that cold chain, and
It
especially
is.
cattle.
It is. It is not only a problem in India. I have extensively traveled in other countries also. I have seen it that there are problems of cool chain maintenance in Africa, in Asia, or in other Latin American countries. You see, there are problems. Definitely, it is not only a problem in India or
Yeah,
Southeast Asia.
absolutely.
Everywhere, there are problems. But this is a very smart approach. This solar panel approach, it is very smart, I think. And if we are thinking about it, in a lot of countries, we can solve the problem
Yeah,
using this solar energy.
absolutely. I mean, the sun is widely available, and so
Yeah, yeah.
it's just getting the tech to use it in place.
Yes,
But
yes, yes,
that's
yes, yes.
fantastic.
This is
uh,
awesome.
yeah, it is awesome. It is. Yeah, and I guess are there any other challenges or maybe even solutions that you'd like to share that you feel are important to share?
Yes, I would like to emphasize on capacity building also.
Mm-hmm.
Advocacy and capacity building. Capacity building, you see, what we are doing right now, you will be very happy to know that we have identified different laboratories, okay, human health or animal health laboratories, and we are uplifting the capacity of the laboratories right now, starting from district level to state level. So we are doing it. And in most of the laboratories, we are working on such a manner that the zoonotic pathogen can be identified, whether it is a human laboratory or whether it is a veterinary laboratory. So things are taken care of in a proper manner. Okay, and we are getting in pandemic fund. We have got a very good amount of money from World Bank, and Asian Development Bank is also our partner of Government of India. So they are working in properly because if the funding is there, then definitely there will be very good work. And already the pilot project have been started in 6 states, as far as I know, and things are going in a right direction. Only one area which is still now not up to the limit, it is wildlife health. Definitely, we need to work more in respect of wildlife health because recently I worked with some not exactly work. I have just given my some of my ideas how to develop the wildlife health in some Southeast Asian country. They have requested me. So you see, almost everywhere in if you are taking the example of all developing countries, you see, uh, wildlife health is very, very neglected. But the major threat of zoonotic spillover is lying with wildlife health.
Yeah,
Okay, that is a big challenge.
absolutely, absolutely. And it's so challenging sometimes to prioritize and fund those very upstream factors. Like you said,
Yeah.
we immediately we see impact from livestock health, but really the major risk or the major threat, is from our wildlife not being healthy, and having threats to them. And so it becomes increasingly more challenging to fund that you can't directly, or that it's more challenging to directly correlate to human health. And so I think that it's fantastic that you're bringing that to the spotlight. It's fantastic that y'all are really working on capacity building because we saw with COVID, once you're in it, once there's a crisis in place, that's not the time to be building more labs, like the
But
opportunity is kind of
you see,
past that time.
even once just before almost 3 years, I worked with Wildlife Fund of India, WWF, World Wildlife Fund of India branch. They have requested me to train the uh, guards who are working with wildlife department against poaching, against illegal wildlife trading. Okay, so I trained them about the zoonotic spillover, how it is spreading like this. Actually, one thing is very important here. It is not only applicable in India but also in other countries also. This is illegal wildlife trade. You see, illegal wildlife trade is a major threat for zoonotic pathogen spillover. Um, People are eating bushmeat. People are transporting wildlife animals illegally. Sometimes some body parts are transmitted here and there. So if it is done illegally and not following the biosecurity measure, there is a chance that they will spread the zoonotic pathogens in different places where the transportation is made. You see, so that is also a very major threat, in my opinion.
Yeah, absolutely. Absolutely. And that's important that you're working on the training portion, and really helping the people to understand um, the extent to which those things
Sorry.
impact their health and others. Oh, absolutely okay. And if you hear little noises for you and our listeners, I have a little visitor here. We have a special guest, um, an additional special guest. Um, so I'm curious about with the challenges and the solutions that you've shared, what's your vision for, for your work and for One Health in India? Where do you want to see these things go?
Uh, uh, I'm very optimistic, actually. My major area of specialization is reduction of antimicrobial resistance in livestock and strengthening biosecurity practice in farm level. Okay, these two things are more interesting for me. And initially, when we are talking about the farming, whether it is dairy farming or poultry farming or goat farming, pig farming, whatever may be, if you want to reduce the antibiotic load, you must strengthen your biosecurity practice. Okay, and there is no compromise regarding the biosecurity practice, and it should be international standard. As an example, in case of poultry, you see, you must introduce this all in, all out process. In case of broiler, actually for last 25 years, it is going on in the industry. There is no problem. But sometimes I am working with backyard poultry. In backyard poultry, it is a challenge
Mm.
because in backyard poultry, uh, they are basically free ranging. Okay, they are roaming here and there. So there are possibilities that they can acquire the infection and they can spread it. So what we are doing, we are trying to keep the backyard poultry in a coop right now. Okay, we have developed some model and we are keeping the backyard poultry in a coop and proper biosecurity measure are undertaken also. And we have watched that the productivity, egg laying capacity, as an example, of the backyard poultry is developed because of this biosecurity practice. What we did, we have restricted movement of all human being inside the poultry coop. Only the person who is going to feed them or who is going to clean the coop, he or she is allowed to enter into the coop. Nobody else. Okay. When they are entering, then we are introducing this food bath. Uh, it is a very simple manner. These are all old practices, you see, but in case of implementation, when you are going to implement it, you have to be very careful and you have to be very dedicated. Only then you can do it. Because in paper, everybody knows everything. But when you are going to work with the farmers, you will find out that there are a lot of gaps. So I am basically working on that so that the farmers can properly implement the biosecurity practices in their farm and they can be properly trained about the biosecurity practices, you see. Then vaccination. In case of vaccination, vaccination is very important. If you are vaccinating your birds or your animals, then you can reduce the chances of disease outbreak 50%, in my opinion. And then one thing is deworming. You should deworm your animals or your birds in a proper time. There are schedules and you have to follow the schedules. There are a lot of farmers who are very careless, who are not following the schedules and they are suffering, you see. If you are not properly doing it, then the production of the animal will be reduced. The animal will have a lot of worm load. The nutritional requirement will be more, but the feed conversion ratio will be less. So these are the basic things. I'm not going to tell you that these are all unknown things. Everybody knows about it. But when you are following this properly, only then you can get the result. Otherwise, if you are very casual about your approach, then you will not succeed uh, to achieve your optimum production. Okay. Another one thing is you see antimicrobial resistance, AMR stewardship, antimicrobial resistance stewardship. I have been working for a long time with this. When I was with USAID at the time, my special emphasis is reduction of antibiotic intakes in poultry industry or backyard poultry farm. I worked very hard with USAID people at the time.
Mm-hmm.
So still now we are working on that because if you cannot reduce the burden, antibiotic burden in especially in poultry and pig industry, then the problem will remain. You see, in our country, another one thing I would like to highlight that ethno-veterinary practice is very popular. We are using certain indigenous drugs which are compensating antibiotics. Okay, so we are promoting these indigenous drugs very judiciously right now, and this is very very scientifically, not only judiciously, very scientifically, and we have seen that when we are compensating it with prebiotic or probiotic in case of poultry or dairy, we are getting very good result. Instead of using antibiotic, we are getting very good result.
Mm-hmm.
So these are complex things. You see, another one thing I would like to inform you that we are fighting very hard to stop OTC, over the counter sale of antibiotic.
Mm-hmm.
Okay, that is a very important thing, and we are fighting very hard. We have our specific regulatory bodies in our country who are working day and night to uh, control it. Because until you control the OTC, it is very difficult to regulate the antibiotic use in animal health sector. You see, so it has to be controlled, and we are trying that. Antibiotics should be sold to the dairy farmers or poultry farmers only as per the prescription given by veterinarians. Okay, so we are working on that, and a lot of success. We obtained a lot of success about it. So these are the major things where I am taking a lot of pain. Okay, as a professional expert in One Health.
Yeah, and I think those, your insight about an international, gosh, I can't talk, an international biosecurity standard, um, I think is a really interesting one. I think it would be fantastic to see, international organizations like, maybe the World Health Organization, really champion that and see more folks integrate that. And I love how you are, have this vision of integrating some very simple practices. I mean, I'm sure that, building building a coop and getting the resources for that isn't always as simple as it sounds, but that in and of itself is a simple practice that can really reduce that risk. And then using the indigenous drugs, I think is really interesting, especially I have a lot of personal interest in, indigenous and folk medicine and really understanding the science behind that and applying that more in our modern health. And so I think that's a really interesting approach that I could also see, people accepting culturally, as well. Really building
Yeah,
in, what's a very traditional practice. So very interesting things, and absolutely for the antibiotics. I mean, I think because that requires a lot of knowledge and understanding of, both infectious disease and animal health and AMR, I think that is important that is more regulated. And so, um, on that note, actually, you've hit on some great points that kind of lead into our next question. What do you wish more people understood about, operational or cultural barriers in One Health?
You see, Ginger, I have some own perception about it. What I feel that we must strengthen our IEC materials, okay, information, education, and communication materials, and it should be spread everywhere. Number two, in my opinion, you might be knowing that I am teaching as a visiting faculty in Indian Institute of Technology and Indian Institute of Public Health. And Indian Institute of Public Health is the second best public health school in the world. Okay. This year I was invited there to teach One Health to their students. In my opinion, that you see the One Health curriculum should be introduced in school and colleges so that the behavioral change should take place. As an example, if I am giving a perception of One Health to a student who is studying in class 9 or class 10 or class 11 or class 12, they can develop some conception about One Health. I already did it with some school students about rabies. Okay. You know that I have been working with rabies for a very long time, and I was working in our National Rabies Control Program and Rabies Free Delhi 2030 because I was the nodal officer of Government of Delhi earlier. So I think that if I will be able to give them a perception about One Health and antimicrobial resistance as well in higher classes, starting from class 9 to class 12, then there will be a behavioral change can be happened in our society. Simultaneously, for college students also, we must develop a proper curriculum of One Health. Since I am developing curriculum for different courses, so I am quite aware about it, that things will be very basic and will give them a basic idea about the One Health. What is zoonotic disease? How the intersectoral coordination takes place? What is the environmental health? What is the human health? What is the plant health, animal health? How they are correlated with each others? And if you want to control that, how the different organizations will come under one umbrella and how they will share the data, how they will prepare the SOP. There are very basic things which can be imparted to them. For your kind information, actually, in in my transform project, when we were working in transform project, we conducted a social and behavioral change campaign. How we did it? We did it through street play, through posters, through banners, through wall painting, and we used All India Radio. Through All India Radio and uh, you see local radio, local community radio, we used them. We spread the awareness about One Health, poultry health, right there, like this. Okay, and it was a very successful program. People got interest. As an example, we have introduced street play in local language. Okay, so people started getting interest, and the street play was conducted, as an example, in a bus stand where people are usually coming from town to a village, and they are getting off from the bus, and there is a bus stand. There are some few shops like this. In this particular area, we have conducted the street play, and we gave the message of One Health approach. You see, it was very successful, and I am very happy that I was one of the pioneer of this program. And still now, still now, I am doing it because I'm almost regularly I'm participating in different programs in of All India Radio. Okay, sometimes I'm appearing in national TV channel also. Um, uh, you might be, you may not be knowing that. I have appeared more than 100 times in our national television channel. Okay, it is called Doordarshan, uh, in different aspects of animal health. Okay, so I think that if this type of activities we can undertake, there will be a change definitely in the society,
Yeah,
and we need it, especially in case of antimicrobial resistance. We must do it because uh, it will be a very very big problem for the human society. And another one thing I will forget to tell, if I am not telling you right now, that phasing out human antibiotics from animal health practice. As an example, in our country, we banned colistin. Colistin is one of the last resort antibiotic in case of human health. Okay, so you have to identify the antibiotics which are used in animal health and which are simultaneously used in human health and essential for human life. You have to ban it in animal health as a growth promoter or as a prophylactic drug. This is
right.
my opinion, and it should be very strict. The regulation should be very strict. So thank God we are working on that.
Yeah, yeah. Make that more of a um, break glass in case of emergency type of
Hmm.
medication rather than a prophylactic one. Absolutely. And I love the idea of the street plays and I have to ask, have you ever like been in the street play? Can is there a video of you doing the play that
This is
I
very
might?
interesting. This is very interesting. Actually, we have conducted it in Andhra Pradesh and Odisha in local languages. In Andhra Pradesh, their language is Telugu, and in Odisha, their language is Odia. So we have conducted it in their local languages. I do not know their languages, but
Oh, okay.
I enjoyed the play. You see,
Yeah, that's
because a
fantastic.
message, a particular message is given at that through
Right.
this street play, and people started getting interest about it.
Absolutely. I think that's fantastic. And definitely, I absolutely agree with your message about integrating this into schools and colleges and youth education. We develop One Health youth education lesson plans and materials with our One Health Kids program, and so definitely, and I teach it to my own kids who do school at home, and so yeah, definitely, I think that's important because then they grow up with that mindset, you know, and entire communities have that mindset, and that really is kind of that building it from the ground up type of approach. And I think that's a very effective approach personally as well. Um, Definitely. So I mean, it sounds like as you said, you know, the street plays and the education, you know, and you really promoting that education on community radio and television has been really effective. And are there any other moments that you'd like to share when that collaboration across people, animal, and environmental health worked really well?
Yes, actually, here I would like to share my personal experience and opinion. That you see, as an example, we are having a lot of private practitioners who are working with canine practice, who are mainly engaged in canine practice. Okay, they are very good ambassadors for giving this type of knowledges to their clients. Okay, they are catering a huge clientels, and I think that through our association, through our professional association, these people should be taken into confidence, and they will also be utilized for the One Health approach and the messages, you see, because they are treating cats and dogs mainly. So, in most of the cases, there are zoonotic diseases like rabies. Rabies is a very big problem in our country. There are a lot of human cries in our country. Uh, for rabies, for leptospirosis, for other diseases, coronavirus. So, they can give excellent communication to their clients. This is a type of extension communication, you see, and we can achieve a lot if we are properly involving the private practitioners. There is a huge base of private practitioners in our country, and already we started working with them, and they are also taking a lot of interest about it. And simultaneously, you see, in our country, uh, resident welfare associations where we are living, there are associations who are looking after the uh, good and bad of the society. Okay, they are taking care of the different problems of society, uh, they should be taken into account also. As an example, rabies is a very big problem in our country, and this is not only a clinical problem, but this is a social problem, in my belief. And uh, since it is a dreaded zoonotic disease, we have to take the local body, uh, civil society, in my opinion, civil society into confidence also. Civil society will play a very major role for One Health approach in our country, not only in our country, but also in other countries also. So this is also my perception. Actually, I worked with them for a very, very long time. And I have found very, very proactive people who can share their knowledge also for expanding the knowledge of One Health. Okay, this is my perception and this is my opinion.
Yeah, I think that's a great strategy, especially as kind of them being community leaders, or being integrated well into the communities and able to share that knowledge and, someone that people already trust as well. That's fantastic. And thank you for sharing that success. Um, and I guess this may be a bit redundant asking, but just curious if there are any other, systems or processes that have supported your success, whether with rabies or with other, programs or challenges that y'all are working to tackle.
Mm, actually, we are always supporting our government. Whatever our government is deciding, we are always on the line of our government decision. As an example, in our country, National One Health Mission is working, and integrated disease surveillance program already I have told you. Okay, this is already existing. Then you see, in our National Center for Disease Control, a Center for One Health has been established, and under their leadership, things are going in a very, very right direction. And mostly, they are working with international organizations like WHO, FAO, World Organization of Animal Health. Okay, and you see, one thing is very enterprising in our country. That's National Institute of One Health has been established in Nagpur, Maharashtra state.
Oh, that's
Okay,
exciting.
that is a landmark for us.
Mm-hmm.
So I believe that especially this is a research institute, and mostly with genetic pathogens, people will work. In antimicrobial resistance, also people will work, and already some work has been started there. There are other organizations. You see, our research organizations, Indian Council of Agricultural Research, Indian Council of Medical Research, they are also working very closely with One Health approach in different areas. They are trying to develop different molecules for replacement of antibiotics, then different vaccines, okay, which can prevent the zoonotic outbreak in our country. Like this, excellent work is going on in our government sector also, and we are very happy. And you see, I can say that in last 5 years, there is a revolution in respect of animal health in our country. We have never seen in our life that such a big amount of money is spent for the development of animal husbandry and animal health and other aspects, disease control, then pandemic control, like this. And India is the only country in the world who started the animal origin pandemic control program in 2023. So that is very enterprising. You see, that is very enterprising, and I'm very proud that I'm working in this country and I'm sharing my knowledge for the development of One Health and for the sake of my countrymen. You see, I'm very proud.
Mm-hmm. As you should be. I think that's amazing, and I definitely agree with you. I think that should be a priority for every government, to protect animal health and prevent um, these risks to human health. Absolutely.
Yes, of course.
Yeah, and thank you for sharing that, and very exciting things for sure. Having the resources and then now having the National Institute of One Health,
Yeah.
um, all the fantastic developments. um,
This is a very big development,
yeah,
major
it
development, I
is.
believe.
That is and definitely encouraging for me as well.
Uh-huh.
So, how can our audience support you further, whether in your work or broadly, or maybe for Heifer International, or is there anything that they can do to support you in this work?
We are always aligned with government of India, like Ministry of Animal Husbandry and Dairying. Whatever the guidelines of Ministry of Animal Husbandry, Dairying and Fisheries are issued, we strictly follow these guidelines. And simultaneously, in different government-sponsored programs, we are also trying to participate very closely so that the farmers should be benefited. There are we have our farmers, producers organizations in different states. For them, we are closely working with the state animal husbandry department or state health department. Okay. So, you see, in India, the setup is like that, that you must align with the government work. Okay. Only then the impact will be implemented in ground level. Okay. And we are getting a lot of help from government also, a lot of guidelines from government also, so that our main aim is the benefit of farmers.
Hmm.
So the aim is same. Maybe the way uh, path is different, but the aim is same, that to give more benefit to the farmers, to control the zoonotic diseases, to reduce the antibiotic uses in different sectors, like this, you see.
Yeah,
So these are the main mottos.
absolutely, absolutely, and I think it is, they call it a multimodal approach. Sometimes it takes approaching the same issue or the same outcome that you're looking for, of supporting the farmers and benefiting farmers from different approaches. To have this very effective. Oh, I can't think of the word, but a very effective strategy, we'll say.
Another,
um,
another, another one thing I will tell you, that we are working for the empowerment of women farmers. Basically, we are
mm-hmm.
trying to uplift the socio-economic status of women farmers through livestock development. Okay, we are using goatry, we are using poultry as um, for the upliftment of women farmers. Okay, what we are trying to do, we are providing them technical support for their poultry or uh, small ruminant business. Uh, we are covering all sort of technical expertise, okay, at their doorstep. In Haifa, we have a model called CAVE, Community Agro Veterinary Entrepreneurs. So they are the paravet staffs who are working in the ground level, and this is a very effective model. And the application is made in different countries, and this is a very successful model. In India, it is called Poshu Shoki also. Pashu Shoki. Pashu means animal, and Sakhi means friends. Okay,
Right.
animal friends. Mostly, it is under the aegis of central government, Ministry of Rural Development and Ministry of Animal Husbandry. Okay, so in different states, ladies paraveterinarian workers are working in the grassroots level. They are doing the vaccination, they are doing the faster treatments like this, and they are educating the farmers. And definitely, in respect of One Health, they are doing the risk communication. Okay, if anything happened in the field where veterinarians are not available, they are taking the news and immediately they are informing the veterinarians. Okay, so the risk communication is made faster, and according to the information, the local veterinarians are taking uh, action. So that is a very, very good thing. You see, this risk communication model we have developed in India, and that is very good. And for that, we covered the grassroots level villages also.
That's a great model, and I especially love that y'all are working on supporting the women farmers as well. We had a recent episode with an NEOH group that was really working on a gender equity framework in One Health,
Mm.
and really shared a lot of evidence and research and just how that supports women, but it also supports the overall goal, right, of public health and One Health. And so fantastic that y'all
If
are providing that support.
actually we in Haifa we have a special model. It is called cave model.
Hmm.
So if you would like to discuss about it in a very elaborate manner, I can talk to my ED, executive director. She can highlight about it.
Yeah, we would love that. We would love that. That could be a
Mm.
great.
That will be a very interesting model. You see, this
Mhm.
model is adopted by World Organization of Animal Health also.
Fantastic, fantastic. So, future
Mm.
episode teaser right there.
Yeah. I can talk to her and I can request her
That
so
would
that
be
she can
fantastic.
share some very good insights about it.
Yeah, thank you. Thank you for the offer. I think that's amazing. Um, and I'd like to wrap up with, I guess, what we had an excellent conversation today. Thank you, as always, for the excellent conversations, Dr. Bhattacharya.
Mm.
What stood out to you most during our discussion today, or if you'd like to leave our audience with, with one thing that you want to impress upon them the most, what would that be?
Mm. Uh, One thing I will tell you that I'm very grateful to God that
Hmm.
He made me a veterinarian.
That's awesome.
Uh,
I like that.
So I'm enjoying my profession and I'm serving my people. That is a major thing, you see.
Hmm.
Um, in our profession, you see, you may not be earning a very huge amount of money, but you can earn a lot of respect from the people, you see, if you are really working for them.
Hmm.
So what I have earned in my life, and I am happy that I have worked for my people, for my countrymen here, and really poor for poor people, you see. And I'm very grateful that at least if I can uh, transform something through my knowledge, through my technical knowledge about One Health or animal health, that is a best blessing from them, you see. Already I have received a lot of blessings from them.
Yeah,
So I'm happy for that.
that's wonderful. Absolutely, it is a huge blessing to get to serve, and I always see it, when we have talked, both on One Health Wednesdays and outside, that that you show that pride and that commitment to serve like you do, and really appreciate you for that as well. um,
If you if you need any assistance from me in future, you are always welcome.
thank
We can discuss about some other topics of One Health related to One Health. Okay, there is no problem.
you.
You
Yeah,
just tell me. I'll
thank you so
prepare and
much.
we'll sit together and we'll carry on
That sounds
because
wonderful.
I'm really finding it very interesting to interact with you. And you see, already a comfort level has been developed.
I know you can just be our regular guest now.
Yeah.
I love it. We'll be
So,
like, here's
uh,
updates from Dr. Bhattacharya.
Thank you.
Yeah, absolutely. Thank you for joining us. Thank you so much for
Thank
your
you.
time and all of your work.
Yeah,
And
yeah. My pleasure.
yeah, absolutely. And thank you, for our folks that are listening. Thank you for listening to One Health Wednesdays. And absolutely, if this conversation resonated, when you have Dr. Bhattacharya, our regular guest now, that you can reach out to. And certainly, reach out to us as well if you're leading from the middle of complex systems and you're advancing One Health in your communities. We would love to hear from you.